1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Hello, everyone. A pleasant and very great afternoon to all of our participants in today's webinar entitled Current Trends on Health Management and Role of Nurses at an International Perspective. This webinar is organized by the Graduate School of Nursing, PhD students. May you all find this topic relevant as it encompasses the ideas and knowledge of both and old and new, especially with very unique conditions that we are currently facing in the medical world due to the pandemic. Ideas are meant to be welcomed and appreciated, and with the students who show their dedication, hard work, and collaboration in making these webinar topics possible is very appreciated. Now, as we begin, let us briefly tackle our goals and objective of this webinar.
The following are the objectives of the webinar. A. To enhance the understanding that health and wellness issues transcend geographically and national borders with cultural competence and consciousness, and having empathy, respect, and understanding of diverse population. 2. To embrace a global health perspective and to competently function in today's healthcare environment and to lead change. 3. To empower nurses in advancing knowledge and education, improve healthcare delivery, and shape policy on both national and international fronts. 4. To install a perspective that shapes the way in which research, education, and practice are approached in nursing and applied to the real world, both locally and globally.
To formally open the webinar, please join us the invocation to be led by Mr. June Christian Reguyal and to be followed by the singing of Philippine National Anthem and the PWU hymn.
Let us bow our head and put ourselves in the holiness of God. Dear Almighty and ever-loving God, we glorify and thank Thee, your name. You have showered us with so much blessings, and your presence continuously reminds us of your faithfulness and guidance. We humbly ask you to shower our speakers today of your greatest inspiration so that they may share the most of their knowledge, heart and soul to their respective topics. May we also absorb the invaluable knowledge, experiences, and put it into practice what we may learn today. We pray that you bless all the committees in charge, that they may be able to fulfill their task responsibly, that the objectives they have set may all be achieved. Your infinite blessing would mean the success of this webinar. May we be a living witness of your genuine love through the enactment of the knowledge acquired through this activity. We ask this in the name of Jesus Christ, our Lord and Savior. Amen.
Kayang magiliw, pero saan sinanganan? Alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyat ka ng magiting. Sa manlulupig, di ka pasisiin. Sa dagat at bundok, sa simoy at sa langit mong bukaw. May dilagang tulad, awit sa paglayang minamahal. Ang kisap ng watawat mo'y tagumpay na nagdidigdig. Ang bituin at araw niya kailan pa may di magdidinig. Lupa ng araw ng at ipagsinta mo'y langit sa piling mo. Aming ligaya dapat may mga aming ang mamatay ng dahil sa'yo.
Now, I would like to present Ms. Amy McGarrick to inspire us with her opening remarks.
Mr. Marco Alfredo M. Benitez, President, Philippine Women's University; Dr. Felina C. Yang, Chancellor and Senior Vice President for Academic Affairs; Dr. Minerva B. De Ala, Dean School of Nursing; Professor Mark Santos, our Professor for Issues and Trends in Nursing; members of the Philippine Women's University faculty, Philippine Women's University students, our participants, nurses here and across the globe, a pleasant afternoon. Welcome to today's webinar organized by the students of Doctor of Philosophy in Nursing program under Dr. Mark Santos for the course Issues and Trends in Nursing. Thank you for taking time in joining us for another of the many sessions of webinars being conducted by the Philippine Women's University School of Nursing. Today, we chose a theme that we believe is very timely and relevant to the lives of nurses during this pandemic. We have invited three brilliant speakers who shall talk on their views on the current trends on health management locally and internationally based on their field of expertise. We are sure that with their delivery of their presentation, we will be able to meet the objectives of today's event. A recorded version will be available through PWU official Facebook account so that we will be able to reach to those who may not be able to join us live but are looking forward to listening to the presentation of the speakers. The unprecedented emergence of the coronavirus COVID-19 caught the world unprepared. The global pandemic, as declared by the WHO, put so much chaos in the entire world, much worse in the healthcare industry. The everyday battle in the clinical area is so much to bear. The health workers' resilience is also tested as the pandemic continued to ravage all aspects of our lives. Our webinar does not reflect the life of our health workers, but somehow it will help us to reflect on the perspective of health workers as we emerge into the international perspective of the role of the health workers. The objectives of our webinar first is to enhance the understanding that health and wellness issues transcend geographical and national borders with cultural competence and consciousness in having empathy, respect, and understanding of diverse populations. Second is to embrace a global health perspective and competently function in today's healthcare environment as to lead change. Next is to empower nurses in advancing knowledge and education, improve health care delivery, and shape policy on both national and international fronts. And last is to instill a perspective that shapes the ways in which research, education, and practice are approached in nursing and applied to real world both locally and globally. Let us sit back and relax as we watch and listen to the presentation of our speakers. Once again, welcome and good day to each and everyone. Thank you very much. God bless us all.
Thank you, Ms. Amy McGarrick, for that encouraging message. Indeed, keeping us updated with the current trends and issues will definitely help us with our nursing profession.
Now, let us hear the inspirational message from our university president, Marco Alfredo M. Benitez.
Good afternoon to the organizers and participants of today's webinar, led by Dr. Minerva De Ala, Dean of our PW School of Nursing, and the students from our doctorate program. In almost every country around the world, nurses provide the majority of healthcare services. They care for patients both in and out of hospital settings, counsel and educate communities, and conduct research to support the improvement of practice and policy. Not only are nurses considered the backbone of healthcare, they are also its beating heart, the source of comfort and compassion during life's most challenging moments. In many cases, that heart is Filipino. The Filipino nurse is everywhere. You will find them serving on the front lines in Europe, the Middle East, North America, and Asia. In the US alone, as of 2019, 1 out of 20 registered nurses was trained in the Philippines. It comes as no surprise that the world's first approved COVID-19 vaccine was administered by a Filipino nurse, May Parsons, in the UK. We find Filipinos at the forefront of healthcare worldwide, perhaps because caring for others is innate in our culture. But demand for Filipino nurses all over the world continues to rise because of COVID-19, coupled with a steady increase in aging populations. The WHO report on the state of world's nursing 2020 emphasizes a global requirement of 6 million nursing jobs. As the quality of healthcare delivery is essentially connected to the state of the nursing profession, the COVID crisis in exposing the shortfalls in healthcare systems has also highlighted the vital role nurses occupy in addressing global health security. If we, as nurse practitioners and nurse educators, are to rise to the challenges of a COVID world and work towards more inclusive and responsive healthcare, we must take on a wider global perspective that includes such issues as gender equity, cultural sensitivity, and climate change. We should also open ourselves to new education theories, embrace holistic approaches, and reframe our relationship with evolving digital technology. It is for this reason that today's webinar, Current Trends on Health Management and the Role of Nurses, an International Perspective, is as timely as it is relevant. As current and aspiring leaders in the field, the task before you is not easy, especially under the current circumstances. But it is during such crisis situations that we find the best opportunities to reflect, learn, and realize our potential. As the physicist Marie Curie said, "Nothing in life is to be feared, it is only to be understood." Now is the time to understand more so that we may fear less. I would like to express my gratitude to Dr. Mark Santos, Professor Emmy Macaraig, and the PW Graduate School of Nursing for organizing this forum. I look forward to a fruitful and vibrant discussion and exchange of ideas. Thank you and good afternoon.
Indeed, it is not easy that what we are facing right now for nurses. To formally introduce Miss Anna.
Yes, to formally start our webinar, we would like to call on Dean Sharon V. Dimak-Tulak to introduce our first guest speaker.
Good afternoon. Before we give the floor to our first speaker, I would like to take the honor of introducing her to all of you. Our first speaker completed her graduate nurse degree at Quezon City Medical Center, now known as the World City Colleges. She took her Bachelor of Science in Nursing at Centro Escolar University. Her Master of Science in Nursing was completed at Guilin Medical University in China. She is likewise teaching English as a second language certified. Our speaker has a long list of credentials. I'm afraid it will take me the entire afternoon to enumerate everything. But let me just highlight some of her accomplishments and achievements so that we may all get a feel of the career path that she took towards her success. She served as a civilian nurse for 4 years at the Regional Unified Command Station, Military Hospital 8 in Tatbalogan, Samar. Later on, she served as the training director at Caregiver Staff Quality Training Center in Intramuros, Manila. She then decided to serve overseas. She was a department head for Women Physiotherapy Department at New Fujairah Hospital in United Arab Emirates. She came back to the Philippines and joined the academy where she served Brokenshire College in Davao City as a clinical instructor for 4 years. After which, decided to go overseas once more and served for 8 years as a teaching consultant at Guilin Tourism University in Guilin, Guangxi, China. She later on became a nurse teaching consultant at the same institution for another 6 years. Currently, she is a nurse educator at Lishui Medical University in Zhejiang, China. Our speaker has attended various speaking engagements here and abroad. She is adept to vlogging. She has about 340 uploaded videos in YouTube since 2020. She is happily married to a now retired PMBer military officer, with which they were bestowed with 6 children, three daughters and 3 sons. 5 of them are already successful professionals in their own rights, and the youngest, who is currently attending the university and will be graduating soon. Ladies and gentlemen, may I present to you our speaker, Ms. Maria Teresita Briones, MSN RN TESL.
Good afternoon, everyone. Thank you, Madam, for the sweet introduction. Thank you so much. Today, I'm going to talk about, not about COVID, but I have been, really my heart is in this area. So the title of my talk today is An Advocacy to Lend a Hand to the Vulnerable. I got this saying by Satchel Paige. He is a famous baseball player in the 1970s. How old would you be if you didn't know how old you are? Let's lend a hand. The old people, the seniors, the elderly. These are all understatement. Rather, a well-fitting regard to them should be the venerable. They are the members of our society who comprises the 20% of the total world population, an estimate that will reach to 2 billion people in 2050. They are the people that we should regard as the unsurpassed in wisdom, the golden age, and highly respected in character.
Of the vulnerable is very essential. Okay, we need to understand. We apologize for the inconvenience and also for the technical difficulties, but nevertheless, as we all know that the vulnerable are the older adults. We are in a inverted pyramid right now of age. Okay.
I have a problem with my PPT and the platform that we are using. I'm not really used to it. So can you see this one too now? Can you see my slides now?
Yes, ma'am.
Yes,
Okay.
we can see your slide.
Okay,
Yes.
so globally, the share of population aged 65 years and over increased from 6% in 1990 to 9% in 2019. That population is projected to rise further to a staggering 16% by 2050, so that 1 in 6 people in the world will be aged 65 years or over. And this will be the scenario in 2050. Every 6 people, there will be one 65-year-old in the midst of them. Closer to home, we can think of our dear beloved parents and grandparents, the old widow and widowers, the old people who are abandoned in the streets, no one to take care of them. The question I will throw to you is, where do they go now? Who will take care of them? This is not an option. This is the solution. The long-term care facilities. There are 4 main types of long-term care facilities for the elderly. These are the independent living facilities, assisted living communities, nursing homes, and continuing care retirement communities. These are only titles, but in reality, these are all the same. The main difference between these types of facilities has to do with how much care your loved one needs or how much you can pay. This is a graph done by 6 students from United States of America, and they came up with this graph about how society views aging. On the lower portion are the countries from Europe. As seen in this figure, which plots the proportion of older adults against how society looks at aging negatively, mostly are from Europe, like France, Portugal, Croatia, United Kingdom, Chile, Argentina, Czech Republic, and lastly, Serbia. Countries who view aging neutral are Uganda, Iran, South Korea, Estonia, Hong Kong, Australia, Peru, and Slovakia. In contrast, cultures with younger population, such as Malaysia, India, Russia, New Zealand, and the #1 country who view aging positively is China. In societies today, the elderly is seen as less valuable since their individualism, self-reliance, and independence would have been altered. Some elderly are perceived in a positive light from time to time because they are actively involved in the community. They are loyal, sociable, and warm. Similar to sexism or racism, ageism. Butler, 1969. He refers to the negative attitudes, stereotypes, and behaviors directed toward older adults based solely on their perceived age. Evidence of ageism can be observed in any number of domains, including workplace. The societal views on aging depends on how family live with or without an elderly and their family. For countries with younger population and live with elderly in their homes, views it in a positive manner. If a child grew in the presence of a grandparents, his or her view is positive from those who grew up without them. My family and I have been living in China for 13 years, and we are a living witness how the Chinese people love their elderly. Traditionally, Chinese people let the grandparents take care of their grandchildren. That is the reason why the younger generations now really respect, love, and honor their elders. This is what we call filial love. According to the United Nations Statistical Survey under the Department of Economics, the aging population is a global phenomenon. Virtually every country in the world is experiencing growth in the size and proportion of older persons in their population. There were 703 million persons aged 65 years or over in the world in 2019. The number of older persons is projected to double to 1.5 billion in 2050. This is also a graph done by the United Nations under the Statistical Survey. Countries under number of elderly 65 years old above. First, United States of America has roughly 56,400,000 elderly. In Canada, which is the second largest country, they have 7 million elderly. Europe has 447,300,000 elderlies. China, the third largest country, has 254 million elderlies. And in Philippines, surprisingly, we have 9,433,000 elderlies. We are only a dot in the map. But Canada is one of the biggest countries in the world, and they have 7 million elderlies, and we Filipinos has 9,433,000 elderlies. The nursing care facilities that this survey shows in United States of America, there are 15,600 nursing facilities. All over Canada, there are 2,007. In Europe, there are 64,000 nursing care facilities, and all over China, there are 150,000 nursing care facilities. And in Philippines, this is so disappointing. We have only 500 nursing care facilities. Actually, there are only 100 or more than 100 only in Metro Manila. This is an exaggeration of numbers because when I was searching about these nursing care facilities in Philippines, I did not really get the right number. This is also a graph on the licensed beds in each country. In the United States of America, there are 1,700,000 licensed beds. In Canada, 198,220. In Europe, there are 3,400,000. In China, there are 7,700,000 beds. And in Philippines, there are 5,000 beds. Some existing problems we are facing now are, according to an article by Malcolm Moore of The Telegraph, he said that China is the most populated country in the planet, that is approaching 1.4 billion people by 2050. It is estimated that there will be 300 million Chinese who are over 60 and above. However, the number of nursing homes or facilities are lower than the population of the elderly who needs care in the country. In fact, the nursing beds that are available now is only 2% of the aged population. In the past, traditionally, the aging parents live with their adult children. But with the modernization of society, families accepted the trend of securing their elderly loved ones in a facility. Together with the effect of one-child policy, that was implemented by the government in 1979, and each family has only one child to be expected to take care of their loved ones. What if the son or daughter will be migrating to another city? So many parents are left alone. Another existing problem in China now is the shortage of caregivers. Site one in the nursing home or long-term facilities. Some problems that are existing are finances. If the facility is run by a private corporation, some family cannot afford the monthly expenses of the elderly. One example is Miss Liu and her older sister brought their mother in a long-term care facility because both of them are working in another big city. The sisters shared 2,000 RMB to make up for the monthly dues in the facility, which is 4,000 RMB. 4,000 RMB multiplied by 7.6 in pesos, that is 30,000 pesos monthly. Another example of an existing problem is a caregiver who is 73 years old by the name of Miss Wang had been working in the long-term care facility for 15 years. She doesn't like to stop because the salary is good. She's receiving 10,000 RMB. 10,000 RMB multiplied by 7.6 pesos. That is 70,600 pesos. Where are you going to get that salary here in Philippines? As a caregiver? I don't think so. But she herself is already needing care. One day, they just saw Miss Wang on the living room floor, just had a heart attack. They found out that Miss Wang was suffering from chronic hypertension and diabetes. The caregiver also need caring. Problems in Philippines. There are surplus of manpower, caregivers and nurses, even graduates of 2-year courses as nursing aides, and graduates of training courses for caregiving. But the problem is, we only have almost 500 facilities all over Philippines. Where are we going to employ our nurses and caregivers? One existing perennial problem that the country is facing is the salary that the caregivers and nurses are receiving is so low, but the work is overloaded, and they are not well compensated. The salary of an ordinary caregiver in a facility is only 16,000 pesos. That is 2,000 RMB or $300. Most of the long-term facilities in Philippines, especially the government facilities, caregivers are not paid. Most of them are volunteer workers only. Facilities in Philippines cost 50,000 pesos a month. 50,000 pesos is 6,500 RMB or $1,000 a month. In America, they have also their share of problems. Many facilities mostly run by corporations, and people who owns it are not even health professionals. They just have the facility because they have the money as financiers. And of course, the income is good. Many facilities are state of the art, modern, and has all the amenities you can think of for an elderly home. But in reality, many families cannot pay for the monthly dues. Some of them just goes there on Saturdays and Sundays and pays $200 per day. $200 multiplied by 51 pesos, that it's 10,000 pesos a day or 1,300 RMB. This is very expensive for a person, especially if they do not have the Medicare or health insurance for the elderly. Monthly dues in a facility is from $255 or 12,000 pesos or 1,500 RMB a day or $8,000 a month multiplied by 50 pesos, that is 400,000 pesos or 52,000 RMB. These institutions hire foreign health workers like carers, caregivers, nurses to do the job, to do the caregiving job. But one thing you can really appreciate is this country pays well. The salary is from $1,500 to $3,000 a month. And that is almost 150,000 pesos in Philippines. Nowadays, many American families just opted to take care of their elderly in their own homes. Or you can see many elderly living alone by themselves, no one to take care of them. I have here some pictures of the facilities in the US. They have also their own activities from morning till evening. So they share jokes, they share card games, they share board games. This one of what the elderlies are doing in China. They do some exercises and swimming during summer. Also board games and mahjong in China. Yoga also in one of the facilities in America. They do painting and many activities. And also conversing to their loved ones if they have visitors, if they are being visited by their loved ones. I'm going to show you a video from one of the facility in China. Let's also watch a video from our own facility here in Philippines.
Narinig yung
Wala. Dali.
Mega, dito na
Meron
mati ako
na.
eh. Ang bata ulit sila. Mega.
Nakamute. Nakamute.
Nakatok ka.
Ha?
Ako may call.
Mahina daw.
Hmm?
Mahina. I personally agree with Mr. Farouk Abazari of Ethiopian Medical Journal of 2018, volume 56, number 2. An aging population can lead to challenges if there is no proper planning. Population aging raises issues of healthcare in the elderly due to changing population demographic trends. The care of the elderly need to improve by developing integrated care. Institution of appropriate insurance, establishing elderly care centers, providing further training to long-time employees, securing for funding for facilities and equipment, increasing elderly's health awareness, and providing life skills training. In conclusion, we can work side by side and lending a hand to our vulnerable. This would be my advocacy, helping the vulnerable that are vulnerable. How about you? Can this also be your advocacy? We can build and open more long-term healthcare facilities and open more jobs for our nurses and caregivers in the Philippines and in other parts of the world. Let's lend a hand, and show our filial love to our elderly. Thank you.
Thank you, Ms. Bronas. An older person is defined by the United Nations as a person who is over 60 years old of age. However, families and communities often use other social cultural references to define age, include family status, like grandparents, physical appearance, or age-related health conditions.
Indeed, Anna, people worldwide are living longer. Today, most people can expect to live into their 60s and beyond. Every country in the world is experiencing growth in both the size and the proportion of older persons in the population. As we all know, a longer life brings with it opportunities not only for older adults, but also for their family and societies as a whole. In addition, years provide the chance to pursue new activities such as further educations, a new career, or long neglected passions. Thank you very much, Ms. Atessa, for a very informative discussion then. We are welcoming all the questions. Okay, you may type it on our chat box, and then we will be entertaining the questions after we finish all the three speakers set. Okay, moving forward with our next speaker. To formally introduce our next speaker, I would like to call on Miss Ami Shang Zhang.
Thank you for the introduction. It's a great honor for me to introduce our next speaker, Professor Zhenzhen Zhao. Professor Zhao is an associate professor in the School of Nursing, Sun Yat-sen University. Her research interests are internal medicine nursing, end of life care, and popular science education in first aid. She has worked in the intensive care unit for 3 years. Since 2010, she has been engaged in teaching and research in the School of Nursing, Sun Yat-sen University. The courses she lectured included internal medicine nursing, emergency nursing, and health assessment. Dr. Zhao has presided over several scientific research and teaching research projects, such as the National Natural Science Foundation of China, the Guangdong Medical Science Foundation, the Guangzhou Municipal Projects, and the school level teaching quality engineering reform projects in Sun Yat-sen University. Besides that, she has also taken part in constructing many provincial and national level first-class courses online, published many papers in Chinese and English. Moreover, she has made many oral reports and memorable speeches at international and domestic conferences. Let's welcome Dr. Zhao with a big applause. Thank you.
Hello, everyone. I'm very glad to join this webinar. I am Juan Zhao from School of Nursing, Sun Yat-sen University. Today, I'm going to share a research program I conducted in the past years, which is a cross-sectional study on quality of dying and death in cancer from the perspective of bereaved family in mainland China. Let me introduce my university briefly. The university name is Sun Yat-sen University. In Chinese, it is Zhongshan Daxue. we have 5 campuses. They are North Campus, South Campus, and East Campus in Guangzhou, and the Zhuhai Campus in Zhuhai, and the newest campus is Shenzhen Campus in the city of Shenzhen. All our campuses are in Guangdong Province in South China, and we are very near Hong Kong and Macau. So welcome you to visit our university. And I worked in the North Campus, which is actually a medical campus. And here are 2 pictures of me when I got my PhD degree. So I hope all of your PhD candidate today here can get your degree, PhD degree soon in the future. Okay, now let me begin my introduction of my research. So first, let me introduce the background to do the research on quality of day and death. In mainland China, cancer has become the leading reason of disease-caused deaths in both urban and rural areas, accounting for 26% and 23% respectively. A good death is an important goal and outcome of the care quality of terminal cancer patients. However, currently there is few research investigating the quality of dying and death as an indicator of palliative care outcomes of patients with cancer in mainland China. So that's the brief background. The purpose of this study is to describe the status of quality of dying and death of patients with cancer who died in hospital in mainland China, and to analyze the factors associated with the death quality of patients with cancer from the perspective of the bereaved family. We conducted this cross-sectional survey from January to December 2017. Totally, there were 10 medical institutions in Guangzhou were involved in mainland China. They were 1 cancer center, 1 community hospital, 7 inpatient oncology unit of general hospital, and 1 palliative care unit. Okay, now as you can see, these are the inclusion criteria and exclusive criteria of our participants, including the patients, deceased patients, and the bereaved family members. In this study, we only included those adult patients and adult bereaved family members. Those patients died of treatment-related reason or injury or died in ICU were excluded from this research. And bereaved family members, those who were incapable of completing self-reported questionnaire or could not be contacted via telephone or refused to participate in this study, were also excluded from this research. Okay, here are the procedure. As I've mentioned, we included totally 10 medical institutions. So we trained 1 nurse in each institution to assist the research. The trained nurses, we called and invited the bereaved family members at the very beginning to ask them to participate in this study. If the family members agreed to join us, and the online questionnaire survey will be offered through a text message with a link of survey website from the main investigator yes. So the nurses are very important in the process because, patients are usually patient and their family, believe their nurses who had ever taken care of them. So this is what the key the step that train a nurse to help in this research. In this study, we use two key instruments. They are Chinese version of Good Death Inventory, GDI in brief, Care Evaluation Skill, CES in brief, which are both originally developed and promoted by Professor Miyashita in Japan. So also patient and family demographic characteristics and the patient's disease-related conditions were collected. This study was approved by the Ethical Committee of School of Nursing, Sun Yat-sen University, and the Ethical Committee of each hospital involved in this study. Here are the Chinese version of GDI, and on your right side is the Chinese version. So in the future, if you are interested in the study of good death, or you need the questionnaire, you can ask me through email. I'll give you email in the end of this presentation. This GDI was used to assess the quality of dying and death of deceased cancer patient in hospital. Here is the second instrument, which is the care evaluation scale. This instrument was used to measure the quality of structure and the process of end-of-life care, especially from the perspective of bereaved family members. We also translated this instrument, and here is the Chinese version also. Yes, if you are interested, you can ask me by email. Now we come to the results. First, as for the characteristics of the participants, totally we collected 305 valid questionnaires. All our surveys were conducted between 1 month and 3.5 years after patient death. For the patient in this study, the mean age was 64 years old. Majority were males and died in the oncology unit of general hospitals. The median last admission days of them was 25 days. And for the family members, their mean age was 42 years, and the female, most of them were the children of the deceased patients. Most of them were employed, has a job, and with higher education and monthly family income per capita of 5,000 yuan. So this is the brief characteristics of our participants, include the deceased patients and their carer, their family member. Here is the GDI total score and the domain scores. As we can see, the average of the GDI total score was 241, while the range is 90 to 333. The average of item score of GDI was 4.5. The range is 1 to 7. So the item score 1 means absolutely disagree on the item, and 7 means absolutely agree. So from here, we can say the level of the quality of dying and death of the cancer patient in mainland China was in a moderate level. And furthermore, we analyzed the domain scores. As you can see, physical and psychological comfort has the lowest score, which was only 2.5, and the good relationship with family has the highest score. So that was to say most of the patients in this study did having obviously pain physically or psychologically. That is also to say physical and psychological comfort at the end of life was the most urgent aspect of care, which are needed to be improved in clinical practice in hospital in the future. Also, we analyzed the predictors of quality of dying and death. In our multivariate analysis, 4 significant positive predictors were found to be independent predictors of the GDI total score. They were higher CES total score, which indicate the quality of care. Patient with a religion, enjoying good relationship with families, being unaware of death. These 4 predictors accounted for nearly 34% of the GDI total score. So from these results, we can see these four predictors represent 3 aspects that are important to the improvement of quality of dying and death of patients. They are the individual patient aspects, family aspect, and medical care aspect. Now comes to our conclusions. In this study, the overall quality of dying and death of patients with cancer were in a moderate level. We found improvement on physical and psychological comfort of terminal cancer patient at the end of life was the overarching aspects of care that needed to be strengthened in clinical practice in the future. And to improve the quality of death, more efforts and innovations on individual death cognition of patients, family relationship, and the quality of end-of-life care was suggested to improve the quality of death of cancer patient. Also, I want to talk about more about our extra funding. I've mentioned that we trained the nurses in each medical institute to help us to contact with the bereaved family members. It is not easy for these nurses also because they never did such follow-up telephone with family members of deceased cancer patients, So these nurses reported a meaningful experience to contact these bereaved family members. They told me that at the very beginning, they are kind of afraid that they were refused by the bereaved members. And the fact was, yes, the refusal rate was very high. But that is understandable. People have died, and they, as their family members, they may feel sad or still grieve. They don't want to talk more about the experience, but also there are 305 bereaved families. They agreed to participate in this study and shared their experience of the period of taking care of their loved family members. So that's also prove that it is available to conduct such kind of research. Although it is very tough, the process is not easy. For the to collect these 305 questionnaires, we used more than nearly totally 1 year in 10 medical institutions. Still, we feel all our team members, we feel it's very meaningful and very meaningful to conduct such kind of research. So we hope the results can help those cancer patients who died in hospitals in the future in mainland China. Our research, we gratefully acknowledge the financial support from the China Medical Board and the National Natural Science Foundation of China. Without the financial support, we could not conduct such kind of research. Also, if you are interested in my research, I'm very welcome you to contact me by email. Here is my email. Thank you very much for listening, and I'd like more discussions with all of you. Thank you.
Thank you very much, Zhuang. Indeed, as we all know that ensuring a good death in individual with advanced disease is fundamental goal of palliative care. However, the lack of validated patient-centered measures of quality for dying and that is an advanced cancer has limited quality assessment. Remember that the quality of dying and death is currently considered as an objective to achieve at the end of the life. Miss Anna?
Yes, Dr. Zhou. Healthcare is increasing focus on end-of-life care outcomes, but relatively little attention has been paid to how the dying experience is subjectively evaluated by those involved in the process. Finally, to introduce our last speaker for today's webinar, we would like to call on Ms. Wendy Jianhua Wu to introduce our third guest speaker.
Thank you, Ms. Anna. It's my honor to introduce Dr. Marilo Furriel. Dr. Furriel has 14 years of experiences of nursing leadership in the Philippines' leading tertiary and GCI-accredited hospitals. Currently, Dr. Furriel is a chief nurse consultant for Mount Grace Hospitals, Inc. She is a member of the United Laboratories Group. Dr. Furriel, skilled in both physician and corporate relations, nursing and clinical services with a strong focus on nursing administration. She is also a co-author of the National Nursing Core Competency Standards in a collaborative effort with the Philippines Regulation Commission, Board of Nursing, Commission on Higher Education, Technical Committee for Nursing Education, and the International Labour Organization as a contribution to the enhancement of nursing education and practice in Philippines. Now, let us give a warm welcome to Dr. Farrell.
Ano ko na? Share ko na. Ano mo share? Hindi. Game lang to. Okay. Okay. Good afternoon from Manila, and good day for all of you outside the Philippines. I was invited to talk about role of nurses, current management of health, using the international lens. But would like to start with telling you the situation in the Philippines, which I think is true, is very true all over the world. Malakihan ko. Malakihan ko siya. Yeah. Yeah. Okay. We are on our second year of nursing crisis. The practice of nursing is on survival mode. Many desirable local and international standards have been abandoned just to survive the duty shifts. Before the pandemic, there is this enthusiasm among many big private hospitals to get international accreditation for safe patient care. However, they began that 15 years ago, but that was interrupted by the present pandemic. Okay, so the key contents of my presentation are, I would like to walk you through the local standards for Philippine hospitals. Not in details, but just for you to have a sense of the local standards of the hospitals. And then we will discuss the international standards as practiced in the Philippines. And then the role of nurses in promoting international standards of patient safety. Okay, I would like to walk you through the local standards. We have DOH, or the Department of Health, Philippine Standards for Hospital Licensure. So this is the local standards. If you want to put up a healthcare facility, you have to be assessed and licensed by Department of Health. And there are three parts of the standards that you have to comply with. Part one is the hospital information, which compose of the technical requirements. I would like to highlight that in the technical requirements, a degree of Master of Arts in Nursing is a requirement for chief nurses. A safe environment for patients, personnel, and public. Adequate and proper maintenance of all its basic utilities. All equipment and instruments necessary for the safe and effective provision of services are available and properly maintained. Hospital evaluates and monitors its activities to effectively assess its overall performance. And last in part one is that hospital provides safe blood and blood products. Part two covers the standards on providing safe and effective medical care services. So the hospital must have a system of proper documentation and management of patients' records. And part three, the last, the hospital has a health promotion and disease program. So the basic accreditation standards were those that I have mentioned. So for you to operate in Philippines, you must comply to those standards. Those are just the headers of the standards. Now, after getting the license and you would like your practice to be better, the second accreditation would be the PhilHealth Benchbook, PhilHealth accreditation. PhilHealth is a local insurance, medical insurance for the Filipinos, and the PhilHealth Benchbook indicates the steps of how to be accredited and the standards that the hospital needs to comply with. And the standards here are more and better than the basic licensure standards. So the compliance to the benchbook is a requirement for PhilHealth organization. And it is very important for hospital to be accredited so that those PhilHealth members, when they go to the hospital, they the PhilHealth payment is deducted to their payment, to the gross hospital bills. Just to walk you through, earlier I walked you through the basic licensure standards. Now we are going one notch higher when we seek accreditation sa PhilHealth. And it has two sets of standards, the patient-centered standards and the facility-focused standards. So the patient-centered standards are 7. One is patient rights and organizational ethics, access to healthcare, inpatient admission and outpatient registration, assessment of patients, care planning, care delivery, medication management, surgical and anesthesia care. So there are steps here and requirements that we need to put into the hospital system for us to be accredited. The second part are the facility-focused standards, which include leadership and management, human resource management, information management, safe practice and environment, and improving performance. Okay, that serves as a background of what we have in the Philippines. Now we will be a little bit ambitious by looking up to the international standards. Many hospitals have sought international accreditation, and the accrediting bodies that they went to are JCI, or the Joint Commission International. 2 is Accreditation Canada International, or ACI, and the ISO. Joint Commission International is a non-profit organization established in the United States of America. And in order to serve healthcare standard requirements of countries outside the United States of America, they created the Joint Commission International, or JCI, meaning JCI is a subsidiary of JCAHO, or the now called the Joint Commission. Why do hospitals apply for JCI accreditation? Because it is designed to stimulate and support sustained quality improvement, created to reduce risk because of its standards, focus on building a culture of patient safety, It is developed by healthcare experts from around the world and tested in every world region. JCI is a build-up for insurance reimbursement. If you remember, there was a time na around 20 or 15 years ago that the country was embarking into medical tourism. And some US citizens carry medical insurances that reimburses only if you are treated in a JCI hospitals abroad. So it is also for insurance reimbursement and for medical tourism purposes as well. These are the patient-centered standards of JCI. So if you could see, there is a little similarity with the bench book standards, but JCI is very, very detailed and it has many, many measurable elements. I will not discuss to you the specific measurable elements in each of the standards. So first is international patient safety goals. This is created to address the common errors that are happening around the world. Mostly the errors are related to wrong patient, infection, acquiring infection in the hospital, communication issues, and patient falls, incidences of falls, and one is a surgical safety checklist, errors in the operating room. So this standard takes care of reducing the errors there by recommending standards. Second is access to care and continuity of care. This refers to how to admit, how to discharge, how to transfer, and how to move the patient inside the hospital. Three are the patient-centered care standards. This is the actual caring of the patient. It's about patient's rights. It's about pain management. This followed by assessment of patients, then care of patients, anesthesia and surgical care, medication management and use. So please take note of this, that JCI is heavy with clinical standards. Healthcare organization standards refer to quality improvement in patient safety, prevention and control of infection, governance, leadership and direction, facility management and safety, staff qualification and education, and management of information. So the Philippine hospitals that are accredited by JCI are the St. Luke's Medical Center, Quezon City, St. Luke's Medical Center, Global City, the Medical City, Asian Hospital and Medical Center, and Makati Medical Center. Now, I would like to discuss JCI as an international standards. We in the Philippines needs to invest a lot so that the international knowledge and technology can be brought to the country. Example for myself, when Makati Medical sent me to train in Illinois, where I was sent to the JECAHO headquarters. I took the training there, and I also had the experience of conducting a mock survey audit sa Edwards Hospital, and many trainings there in America. And there were around 3 of us who went there, and the hospital was investing on training. And then setting up the standards required by JCI in our hospital also requires investment. For us to comply with the requirements, we have to really invest so much. And these are in terms of millions. And now these 1, 2, 3, 4, these 5 hospitals have standards just like the American hospitals. So when I went to New York, I visited St. Luke's Roosevelt, and I visited Sloan Kettering in New York because they are all JCI. The practices there are the same as in these 5 hospitals. And most of our nurses who came from these hospitals have no difficulty adjusting to the systems of the Americans. And they preferred our nurses even if they did not come from the JCI facilities, because they say Filipino nurses are very caring. More so if they are coming from the JCI accredited hospitals who are trained in the Joint Commission standards. So this is not good for the supply of nurses, because the better the nurses become, the more they are marketable abroad. Now, what are the effects on the use of JCI standards in nursing practice? If we use international standards, what would be the results? In my experience, because I have been using JCI standards for the last 11 years, these are my experiences. The RN-MD, or the nurse-doctor relationship, became more professionalized, especially in patient care management. Because with JCI, the procedures, the interventions have become protocol-driven. There is an improved communication among healthcare members. We achieved a just culture through the non-punitive system, because JCI is system-oriented, it's not person-oriented. And more importantly, the nurses who used to be at the sharp end have achieved some level of empowerment. In addition, nurses' professional well-being is addressed, safe practice is addressed, and the total patient care makes patient care safer. But if you notice in these hospitals that provide this kind of safe that provide this kind of care, it's a little bit costly, because as I have mentioned, hospitals invest in quality. The second is Accreditation Canada International. I have no experience in Accreditation Canada, but I'm bringing this up to you so you would know that there is another model where the hospital can get an international recognition. Accreditation Canada International have area. This is the process of ACI. They will see what the services that you have, and based on what you have, yun lang yung i-audit nila. Yun yung, that's the only areas that they will survey and help you improve on. Example, if you have ambulatory care services, they will check that. If you don't have an assisted reproductive technology, then that's not taken up. If you have biomedical lab, that's taken up. Cancer care, case management, child, youth, and family services, critical care, home care, governance, infection prevention. So if all of these services are present in your hospital, then each of these has its own standards that the hospital must comply with. And Philippine hospitals that are accredited by Accreditation Canada are Manila Doctors Hospital, Philippine Heart Center, Davao Doctors, Asian Eye Clinic. The third accreditation standard sought by hospitals to be internationally recognized is the ISO. I think there are many offices here in Manila and many agents here that can do ISO uh, training, preparation for accreditation. So ISO is an international non-government organization made up of national standard bodies. It develops and publishes a wide range of proprietary, industrial, and commercial standards and is comprised of representatives from various national standard organizations. What is ISO and its function? The International Organization for Standards, or ISO, is an international NGO. Oh, okay, I've just mentioned this already, double PowerPoint. What is an ISO certified facility? An ISO certification certifies that the management system, manufacturing process, service, or documentation procedure has all the requirements for standardization and quality service. ISO standards are in place to ensure consistency. Each certification has separate standards and criteria and is classified numerically. It is important because it provides a strong basis for development of national and international regulation, helping save time and reduce barriers to international trade. You know, in Europe, they say if you make business with Europe, you should be ISO certified. So if you notice, there are most of the clinics that clear the seafarers and other OCW who will be deployed in Europe, their clinics are ISO certified. Many hospitals in the private and government sectors are ISO certified. Maybe because among the three, this is the cheapest program. The significant difference of JCI from the two international accrediting bodies, so we have three, JCI, ACI, and ISO. It is JCI that has the most patient-centered and prescriptive standards. So it is really tailored fit for a hospital. Now, I would like to share with you that I've been to Europe, been to US. I saw the practice there, and the practice of our Filipino nurses here. I think the advantages of those abroad is they are more superior in terms of technology, hospital information system, and you know the accreditation systems that they have. But that is their edge. But the edge of the Filipino practitioners, Filipino nurses here is they are very caring. So whether our nurses have practiced and have experienced the international way of doing things, even if she has not gone through that, she is very much welcome abroad. I have a daughter who's trained in a JCI facility here in the Philippines, that which is Makati Medical Center. But she went to London, and you know, international standards varies because the standards of London is not JCI. It has its own standards, and some of the care protocols are very different. So still, the main problem of the Philippines is we are losing nurses. We don't have nurses, and we keep the very few we have is we are losing them. And for the last 4 years, we did not have graduates because of the implementation of the K to 12. So in the last 4 years, we did not have fresh graduates who were supposed to replace those who have gone abroad or who went somewhere else inside the country, because there are also PPOs. So we are on the survival mode. With the pandemic and the shortage of nurses, we are in a very precarious situation. Philippines is one of the largest producer of nurses. And the sad thing is most of the brightest nurses have left the country because they are the first to pass all the examinations, all the required tests for them to go abroad. And many of those who left to work abroad chose to become citizens of their new home country. So really, very few will return to the Philippines, not unless she's coming from the country that do not offer citizenship. This makes nursing practice always on the learning mode. So it's nice to talk about international standards, but as of now, even the local standards are very difficult to achieve. So when we say the nurse-patient ratio is 1:12, that's for DOA as per DOH standard, they can handle more because there are no more nurses. What we are focusing now very strictly is only on the infection control because of the COVID. But other than that, anything goes so that we manage the patient and, we manage the staff. And as you all know, healthcare is collapsing. We just almost collapsed last September surge. Now we are able to recover. But with the Dolomite opening and people are crowding, we might soon have another surge. So thank you, and we'll just entertain your questions for that question that I was not able to discuss. Thank you.
Thank you very much, Dr.
Thank
Fredo.
you.
Indeed, as we all know that the healthcare accreditation standards are advocated as an important means of improving clinical practices and also the organizational performance. Remember that the standards development agencies have documented methodologies to promote open, transparent, and inclusive development processes, where, as we all know, that the standard are developed by members. There asserts their methodologies, as we all know that these are effective and efficient in terms of the producing standards appropriately to the healthcare industries then. Yes, Miss Anna?
Yes, accreditation means the systematic evaluation of healthcare centers. In this process, the opinions of a group of experts are noted to evaluate healthcare organizations and make decisions about granting them qualifications.
Yes. For our guest speakers, thank you very much for very informative discussions about the roles of new nurses in different professions then. We hope this added knowledge will equip us in our different fields and also for our participants then. To facilitate with our forum, we would like to call on our three guest speakers to turn on their cameras, and then we will be entertaining questions accordingly then. Okay? So Miss Anna?
Yes, we have asked our participants to leave their questions in the through the YouTube chat box or the Facebook comments. And now we are receiving some questions from the audience. And see, here we have a question for Ma'am Brions, our first speaker. And
Yes.
Our participants are asking, at present, many young people are unwilling to work in the services for the elderly. How can we make measures to attract more young people to work in the service for the elderly?
Yeah, thank you for the question, Anna. You know, if we use the media is mighty, media is mighty. We go and disseminate about elderly people. We go and disseminate about those nursing facilities that are existing. And then we go and educate people that these facilities are for elderlies and we need this kind of services and kind of people who has a heart to take care for these elderlies, and of course commensurate with the salaries. That is number one. If the salary is good, they don't care about whom they are taking care of. They don't care about it. It's number one is the salary. Because let's see, let us go to this reality. I am 61 years old nurse. Okay, there are COVID patients. One COVID couple called me and asked for my services. Did I say no? I said yes, but it's dangerous for me. Why did I say yes? This couple, the male is aged 78 years old and the woman is 61 years old. Both of them are COVID and they are experiencing on the most crucial phase of COVID. I did not say no. Number one, I cared for them because no one wants to care for them. Number two, of course, the salary. If you will be offered 4,000 pesos in 1 hour, will you say no? Of course, I will say yes. So, but it doesn't mean that we're going to give 4,000 pesos to a caregiver or nurses in the facility. Of course not. But if the salary is good and commensurate to the work of the nurses and caregiver, of course, the young people will be attracted to this job. And then, as I said, media is mighty. We have to give information through media, radio, TV, newspapers, and everything. I hope I have answered your question. Thank you for the question.
Thank you very much. Yes. Thank you very much, Ms. Brianis, about the salaries also with our multimedias and Mighty then. Okay. We have also a question here from Dr. Zhao. Okay. From our Facebook, someone asked, the trained nurses contacted bereavement family members. What did the nurses do in the process?
Okay, thank you. Thank you for the question. Yes, specifically, the nurses in my research was the knocker who opened the study, the first person to contact the bereaved family member. You know, they called and invited the family members to participate in this study. In fact, we have developed a very standardized telephone communication process. In this process, many detailed communication skills, such as how to address family members and how to address deceased patients. The preparation of these details makes the bereaved families who answered our phone make them feel comfortable and easy to further talk with us. Then the nurse asked the family members what is their current living conditions, and next carefully lift the deceased patient. They will ask about the living conditions and the physical conditions of the family members since the death of the patients. Next, they explained that there's a research and they want to invite family members to participate in the study to just evaluate the quality of death and the end of life care of the patient, their loved ones, with a view to improving the quality of care for advanced cancer patients in the future, to help more patients and their families. So yes, the knock of the research and in fact, we did some qualitative interview after the questionnaire survey, and also some of the nurse participated in the interview process. That's all the details in my study. I hope to answer your question. Thank you.
Thank you, Dr. Zhao. That's very practical suggestions. Yes, all the details are very matter during the preparation and during the whole research process.
Yes.
Yes, yes, Miss Anna. Then, and I also have a question here from our Facebook inquiries. Then, so for Dr. Frio, yes, how accreditation improves the nursing service and also the practice in terms of our COVID situation right now.
Um, okay, the standards of the accreditation helps improve patient care and practice of the practitioner, the nurses and doctors. But if the question is directed towards COVID, if you have no more nursing supply, that is the difficulty. That is the difficulty because all corporate, all the hospital leaderships now are into massive recruitment because, as I said in my introduction, we are now on the survival mode, and some of the standards are even abandoned. So just so we can survive the shift. We are just the precious standards that we are still clinging on are the infection prevention and control to save ourselves and to save the patients. But these standards are very good, but especially if we are in times of COVID, on one condition, we have the right staffing. That is the problem. I don't think, even in the local standards, the simple DOH standards, we are deviating, violating it because simply there's no more nurses. We are even upgrading our nursing assistants, and we are trying to be very creative on job delegation, etc. Uh, we have, if you notice, we have increased the nurses' salaries significantly during these pandemic times, and hope after the COVID it will not go back to its former rate.
Yes.
Yes, because as of now, well, they're only several thousand away from 50,000, but still no supply because the last 4 years there were no graduates. So accreditation, the problem with many of hospitals is the only standards we're using are the PhilHealth bench book if we are PhilHealth accredited, and if not, and we're a new hospital, we're using the DOH. But as you know, these are not very strict in enforcement, unlike in other accrediting body that really, because you pay them, they're very strict in monitoring and teaching you in order that you comply. But in the absence of nursing supply, the most important is to have the nurses. That's the first standard, right staffing.
Thank you very much, Dr. Pirio. As we all know, that tailor fitting the accreditation in the midst of pandemic is very essential. Yes, we are also not only facing the pandemic for the infection, but we are also being challenged in terms of the manpower for nurses. Thank you very much. Miss Anne, we have questions, I think, from Tessa.
Yes, we have another questions for Madam Tessa. And
Yes, ma'am.
yes, the question is, like in your example, you mentioned the aging society in China, and there are few nursing professional working in the elderly care. And how do you think we can promote the elderly community nursing practitioners?
I'm sorry. Your question is, can you
Yes.
restate your question, please?
Yes, I will. It's quite similar to the previous ones, and we are all concerned about short of nursing talents in the aged care facilities. So these questions actually is for the community. So how can we encourage the nursing to work in the elderly community as a nursing practitioners?
Oh, okay, thank you for the question. Okay, nurses doesn't really choose where they will work. We choose how much salary we're going to receive because it's all the same. We work in the hospital, we work in pedia, we work in geria, we work in surgical, we work in medical, we work in any department. It's all the same. as long as we are paid in a compensated manner, as long as the salary is good, I think many nursing professionals will go into elderly care because it's better to work in an elderly care or facility because there are no diseases. They're only aging. The problem is only aging. Okay. The daily activities that are disrupted, we are just there to help them eat, to help them go about their daily living, but they are not sick. So I would rather work in an elderly care center than working in the hospital. So if the salary is good, if the salary is higher, so that is where we are really, the dilemma is there really about the salary. What Dr.
For you.
Forio
For
is
you.
talking about, yes, that she's saying that the nurses now are receiving almost 50,000. How many are how many of them are receiving 50,000? That is my question now. Is that really the reality? How many are the nurses who are working in one hospital? How many of them are receiving 50,000 or 48,000? How many of them?
I
I
think
think
Ma'am Brianes, Dr.
yes.
Ferrier would like to answer, I think, this question. This is what we are facing right now in the Philippines. It's a big, big question. Yes, Dr. Ferrier, you would like to say something?
Okay. You know, the government hospitals are offering bigger salaries now. And the move, as I saw it, is there. It's now in the 40,000 and counting, and counting. I know it because we are making a study in the hospital network. We would like to see where the nurses are going. So we're making uh, we are making a supply and demand of the nurses, supply and demand requirement of the nurses. So because there were no graduates in the last 4 years, so and nurses continuously left for abroad. So imagine you have no supply for the last 4 to 5 years, and those who have left were never replaced. And here we are, many new 100-bed hospitals have been built. There are more hospitals now. And secondly, the COVID came in. So we need more staff, but there are no nurses. And we see that the regular graduates will start to have that in 2023 or 2024. So 2 to 3 years more of suffering in the nursing shortage. And those big hospitals, those who can offer, well, there are many hospitals now are even closing some of their wings because there are no nurses.
Yes. Thank you very much, Dr. Furio, for your very informative discussion about the salaries and also, yes, Ma'am Brianes. In addition,
If I may add, Dr. Forio, the graduates that we have since 3 years ago, since 4 years ago, are still around. They are still around. There are only how many percent who left? They're still here, so many of them. If you walk on the streets and talk to them, how many of them you're going to meet? 10 people, 6 of them are nurses. They're still around. There are only how many of them who left?
There are requirements in the BPO. So if you would like to know, they are paid higher. The BPO buildings are as big as the hospitals, if you know that. And they need licensed nurses for their BPO operations. So most of the graduates are going there. They are paid higher and no patient encounter, free from COVID, and they're paid higher. So the supply of where are the nurses going? Internally, they go to private duty nursing because they will take care of only one patient. Even if it is a COVID case, it's one patient, one nurse is to one. If you are in the hospital, it could be 1:5, 1:6. But in private duty is 1:1. In times of COVID, it's very important the number of patients you are exposed to. And private duty has a hazard pay of 2,000 on top of the rate every 12 hours. And then, so where do the graduates, remember, there are no graduates in the last 4 years. So we are just, let's say, nag-aagawan na lang tayo. We keep just poaching nurses from other hospital as well, just to transfer to us by offering better salaries, benefits, and packages. Others are even recruiting from provinces, far-flung provinces, and they are putting up dormitories, so that the hospitals can keep operating.
Yes. Yes, it's very essential nowadays that how you market your place, your institution to gather all nurses in your particular institution is the manner on how you entice these nurses. Yes, with rejoinder to Miss Brianna's mentioning that there are a lot of nurses, but for Dr. Furio, yes, there are a lot of nurses, but it depends on you on how you keep these nurses then. Because this is not only for hospitals. You are not only dealing with the hospital, but you're also dealing with the BPO companies. They're offering much higher than what the hospitals are offering right now. Thank you very much, Mom Briannas and Dr.
Thank you.
for your very we appreciate this discussion. That yes, I think Miss Anna, we have another question from Miss Dr. Zhao.
Yes, and the question is the how to give palliative treatment to cancer terminal patients in the hospital you're working in.
Okay, I think this question is for me, right?
Yes, Dr. Jia.
Yeah, this question asking about palliative treatment, right?
Yes.
Right. Yes. I think we all know palliative care mainly includes multidisciplinary, and also we should refer to patient physical, psychological, and social care, and etc. During the palliative care process, I think the doctor is responsible for the medication to relieve the patient's symptoms, and the supportive care, communications, and death preparation issues are more related for nurses' work, for our nurses to organize and coordinate these kind of issues in Guangzhou, most of the hospitals, I think. Yes, patients in my research are those who died most of them died in oncology department of general hospital. Yeah, that's what I know about the status about palliative care in this general hospital. Yeah.
Yeah, thank you. Yes, we need a multidisciplinary team to look after the patient at the end of their lives.
Yeah.
And also, I think you just mentioned the majority of your patients died in the hospital, but actually there are more people who are willing to spend their last life at home. So I think that's the other direction that we can working on as nurses.
Yes.
Thank you very much, Mr. Dr. Zhao. And to facilitate with our time frame, we are seeing more questions coming in from our Facebook Live and also with our YouTube. But unfortunately, we're unable to accommodate such. But we would like to give thanks for you guys or for showing interest about this topic. Then, and last question would be, Dr. Furio. We have questions here. Last question is, the Philippine nursing education has trained a large number of nursing talents. Through the lectures, we learned that there are many nurses losing in the Philippines then. So what measures have Philippines nursing educators taken to avoid the loss of nurses?
I think the one being asked are the educators.
Oh, maybe
I
you
am,
can yes,
yeah, I am the,
or for the service maybe that.
yeah. Okay. I am studying the supply and demand of nursing requirement. And based on the statistics that we got from the various schools, which I have not completed yet, I can see that there's an increasing trend of enrollees.
Yes.
So the first year enrollee now and the second year are greater than the third year and fourth year. So, but however, the demand is still greater. So we can see this um, waiting time for the right production. You still need to, well, 4 years to have an adequate supply of nurses. And then, other than that, as far as the hospitals are concerned, they really have to be creative in recruitment and retention. As you know, this is the law of supply and demand. Now, sa school naman, we see that there is an increasing trend of enrollees. And why not? In this time, the one that survive are the essential industries. And healthcare is an essential industries. And that is, when we say essential, while all other industries have closed and bankrupted, the healthcare remains standing. So,
Yes.
aside from nurses' salaries have been increased now, the better pathway is to go into nursing.
Yes, definitely. It's survival of the fittest. And then remember, hospitals or institutions who are offering healthcare services, they still need to wait 2 or 3 more years.
Yes,
Yes.
yes, yes.
And
That's
then,
the projection.
yes,
For
most
now,
probably, yes, go ahead.
as for now, as per POEA posting of published job orders, 3,700 are required to go abroad.
Wow, there's a lot. And that is not only in abroad then, but also that is not only for hospital institution, but also for other specialization. As we all know that we are in the inverted pyramids right now. So there are a lot of sprouting institutions like for geriatrics, what we taught by Ma'am Tessa earlier. And also remember that being also an academic academicians or being part of the academic field, what we are facing right now also is the skills development of our nursing students. As we all know that we are also on the online platform right now. So most probably, Dr. Furio, your learning opportunity or the opportunity in your area is how will you plan or prepare the nursing students in facing the reality? Because we are in the virtual reality, but let us face sooner or later that the graduates would be in a real setup. So this will be a good opportunity of a good challenge or a good state that the hospital should be prepared for this virtual nurses. Okay.
Okay. Just like any other big hospitals, we believe that the we accept the nursing graduate based on the terminal competencies that graduate has accomplished. But receiving hospitals have different levels of requirements. And if you're a big hospitals, you may have a higher skills requirement. So in my hospitals, what we do is we put up a more in service program to further hone that newbie nurse that we hired. So we really don't blame the school if that is half baked or whatever. We just have to continue the teaching. That is, we have no time to blame. We only need, in Tagalog we call it, we only need the katawang lupa and lisensya. And then, bahala na kaming gawin siyang nurse.
I see. Oh yes, indeed that the collaboration between an
Yes.
academic aspect and also for the nursing service is very essential. Okay, so to formally conclude with this, we appreciate everyone about how we answer also the questions, and also it is very essential on us for nurses for future nurses, which one you would like to be. Okay, in a service, in a palliative care, or in education. It depends on you then. There are many choices, but it's up to you on how will you choose this nursing service or nursing factors then. Okay? So thank you very much. So we will now proceed with the awarding of certificate of appreciation to our guest speakers. Okay, for our guest speakers, please stay on the line. Okay, we would like to call on Dr. Dean Minerva D. De Ala, the Dean School of Nursing.
Thank you, Dr. Joel. Can we now have the slide for the certificates? Okay. Philippine Women's University hereby awards this certificate of appreciation to Miss Maria Teresita Briones in grateful and sincerest gratitude for her selfless and commendable service rendered as our resource speaker today during this conduct of webinar entitled Current Trends and Health Management and Role of Nurses, an International Perspective. Given this 20th day of October 2021 at the Philippine Women's University, Manila, Philippines. Signed, Chairperson, Professor Emmy Macaraeg, and Dr. Mark Santos, the professor of this subject, Current Trends and Issues in Nursing, and yours truly, Dr. Minerva De Ala, your Dean of the School of Nursing. Please accept our certificate of appreciation, Ms. Briones.
Thank you so much.
Okay, to read this. Okay, thank you too. Okay. Okay, this certificate of appreciation is awarded to Dr. John Zhao. Okay, in grateful and sincerest gratitude for her selfless and commendable service rendered as the resource speaker during the conduct of webinar entitled Current Trends on Health Management and the Role of Nurses, an International Perspective, given this 20th day of October 2021 at Philippine Women's University, Manila, Philippines. Signed, Professor Emmy Macaraeg, the chairperson, and Dr. Mark Santos, the associate professor of this in charge for this subject, Current Trends and Issues in Nursing. And of course, your dean, yours truly, Dr. Minerva De Ala. Please accept our certificate.
Thank you. Thank you very much.
Thank you. And now for Dr. Forio. So Philippine Women's University hereby awards the certificate of appreciation to Dr. Marilo Perlas Forio in grateful and sincerest gratitude for her selfless and commendable service rendered as the resource speaker during the conduct of webinar entitled Current Trends on Health Management and Role of Nurses, an International Perspective, given this 20th day of October 2021, Philippine Women's University, Manila, Philippines. Signed, Ms. Emmy Macaraeg, the chairperson, and Dr. Mark Santos, the professor in charge for this course, Current Trends and Issues in Nursing, and yours truly, Dr. Minerva De Ala, your Dean of the School of Nursing. Dr. Forio, kindly accept our certificate for you. Thank you. Thank you, Doc.
Thank you
so
very
much.
Thank you, Dean De Ala. To all of
Yeah,
our guest speakers, we appreciate the time and efforts you have shown today. And to formally end the webinar, Ms. Alina Navarro will now deliberate her closing remarks.
My apologies.
It's okay.
Again, as part of the closing remarks, I would like to say that my personal experience being 46 years as a professional nurse and as a leader, I am so grateful that I am a part of this webinar. It is highly motivating, it is highly encouraging, and more so, it's very empowering. So again, I have to say to all the speakers, you have given us and provided us a new horizon of mindset, focus, but also a new level of commitment. I have to say that I hope we all learn the following, that there is something to know more. And today we found out that there are so many new things truly that we can explore as nurses. Something to be challenged and encourage us all to move forward, but also not only to speak up, but focus on the actions of what we can do. I am so proud of Tessa on how you presented the flight the difficult flight of our nurses. Again, yes, it's very important that the wages must be improved. But then again, we need a good avenue of legal advocacy to help our Filipino nurses, not only in the Philippines, but also abroad. Something to know better and aspire for new skills, complex skills, and way of thinking. There are three important domains that are changing in the healthcare. Again, the business model that patients are customers. Second is the significant increase in the aging population, making it so complex that the chronic management of the aged or the aging population, and again the increase in the digital technology. Now, everything now, when you are as a nurse, you're expected to be a leader, you're expected to be an innovator, you're expected to be a transformer, and of course, technology-wise, you need to be truly be abreast of advances in the technology. Again, we focus on the culture of respect. Again, the culture of respect is being embedded now in all models of care. And I'm so happy to hear from Miss Tessa about the importance of compassion and having the commitment to really be aware how important is to take care of our family members who are in the aging process like me. I am 67 years old, and what has been said today is truly an eye opener for everyone. Again, the nurse must be embracing all opportunities that can truly be of benefit, not only to her knowledge, not only to her attitude, but also to her skills. I also believe that we need to be innovators of changes because every second is changing. Again, I thank you, and I would like to really end these closing remarks. The leaders who had been presented from China, Philippines, I'm very proud to be a part of this nursing profession. You made us all feel very proud that this is a high time that we need to move forward. Expertise should be shared, knowledge should be shared, and more so the high level of experiences. I'd like to end this note to say I'm so grateful and I feel very empowered. Thank you so much.
Thank you, Maria. Thank you for your closing remarks. And for our participants, the validation link is posted. Please complete the form and submit accordingly. Certificate of attendance will be sent to you within 7 to 14 days.
Okay. So I think Miss Anna is having internet connection problem. But we would like to thank our participants. The evaluation link is posted. Please accomplish the form and submit accordingly. So certificate of attendance will be sent to you within 7 to 14 days. So make sure that you need to scan the QR code or the evaluation link provided on your screen. And then we would like to thank everyone for joining and participating in this webinar. We hope to see you again on our School of Nursing PhD webinar sessions. Thank you and have a great afternoon.